If you look at many of the chronic conditions that are present in our society today, inflammation plays a huge role. A lot of the treatment for these conditions is to reduce inflammation in the body, and that can be done in many ways. You can avoid refined sugar. The other interesting thing when we talk about fibromyalgia, you want to treat it with reducing inflammation and exercise and those things, but fibromyalgia also often mimics opioid-induced hyperalgesia. So in the past, patients would be prescribed opioids to treat fibromyalgia pain, but it's probably not a great drug to treat that condition. And if the opioids lead to opioid-induced hyperalgesia, which mimics the symptoms of fibromyalgia, oftentimes you're either making the fibromyalgia worse, or sometimes the patients are misdiagnosed with fibromyalgia when it's actually their symptoms are being caused by chronic opioid use. So for any fibromyalgia patient that's on opioids, I will oftentimes recommend let's try weaning or detoxing from the opioid medication just to see what gets better. Because as discussed, opioids are great right after accidents and right after surgery. But long-term, they can cause more problems than they're worth. So I think everyone deserves, especially chronic fibromyalgia patients that have been on opioids for a long period of time, I think everyone should consider detoxing or weaning off of opiates to determine what's the true underlying pain, and then you can treat whatever's left after the opiates are out of the